Northwest Premier Lazarus Makhosi wants a case of statutory rape to be investigated after a teenager gave birth for the second time. It's believed the girl has been pregnant twice by the age of 15. At the same time, the Eastern Cape government is probing the circumstances surrounding a 12-year-old who gave birth on New Year's Day. According to the Eastern Cape Health Department, 94 girls in the province between the ages of 10 and 14 have given birth at public health facilities since April. For more on this, we are joined by child rights activist Dr. Siyabonga Nzimande. Dr. Nzimande, thank you so much for the time this morning. Thank you for joining us on Newzroom Afrika. We need to police this better. How?
Greetings to you, Arabile, and also greetings to your viewers. I think what is very important is we need to begin to define it correctly. I think the definition as it stands when we're speaking about teenage pregnancy, and we need to come down and really begin to talk about child and adolescent pregnancy. And also we need to, when we're talking about child and adolescent pregnancy, we begin to apply the correct legislative framework that speaks directly into how are we dealing with the Child Protection Act. If then we are beginning to join the puzzle, because for many years, this is not new, and politicians always get surprised when it's December time or it's Christmas time or New Year's babies welcome, and we're saying that we are shocked that a 12-year-old gave birth. We are shocked that a 13-year-old gave birth within the underage that we are beginning to determine according to the legal framework of South Africa. However, what is shocking for me is that these numbers are true and they've been presented relevantly enough throughout the year. If you go to June, if you go to August, every month in South Africa, we are sitting with a total number of under 16 young girls delivering babies. And we are talking at this at a health perspective, but we are not beginning to speak about it as a criminal offense. And now when we are beginning to look at the premiers who are now speaking about it and saying, and the MEC in the Eastern Cape as well, as you've correctly alluded, that this is statutory rape. I think as activists in the space and civil society in the space, one of the biggest cry has been, why are we talking about these numbers, but we're not talking about prosecution? So what will then begin to make sense now and what we are rallying behind, which is really beginning to give us some joy and comfort, is that we are beginning to talk the right language, that something needs to be done legally and something needs to be done. We listened to the MEC for Health in the Eastern Cape saying that we're in conversation with social development. And one is really looking at that and saying, I really wish we have a conversation where we say, we are having a conversation as a multiple stakeholders, which are within government. The National Prosecuting Authority, social development must come in play. Department of Education must be in play. Health must be in place. So it's not just the social cluster alone, but it's including that legal framework that needs to take place. I think for me, a question when you say how, I think the conversation now is beginning to say, let's identify what are we talking about. It's not just teen pregnancy. We're talking about a child and adolescent. Therefore, the right acts need to come into play.
Couldn't agree with you more then, but then do we then need to change policy after that? And I say policy in terms of rule of law, in terms of how this works then, because if we as a country are trying to end that scourge of underage and adolescent pregnancy, and by definition, in other ways then, more likely than not, we're also talking about statutory rape, should we not then have that law in place? Should we have policing that is better with regards to something like this, so that even those people that do come forward or are pregnant then have a way and a methodology to then express themselves and not feel like they would get any reprisal?
I think we might not necessarily need to change the law, but we might need to enforce the law. If you look at the Children's Act, it already makes provision. If you look at the Child Care and Protection Policy, is already making policy. Even the National Youth Policy is also making provision. But where we are finding it hard is when we sit in these rooms and discuss these early unintended pregnancies, the contradicting policies, whereas one policy says this and one policy says that, we need to empower healthcare workers to be able to report adequately these child and adolescent unintended pregnancies and ensure that we are speaking to one another. And I'm going to just be real with you and say health is presenting one data that speaks about how many children gave birth. But at the same time, how can we make sure that our legal department and our authorities are also speaking to that very same data at the same time and saying that we are also dealing with that? There are so many prosecutions that we have done of statutory rape in South Africa, and those numbers are directly linked to what we are speaking about. You got social development that is coming with their beautiful programs, which is YOLO, you only live once, and they also got CHOMI at a lower primary level. Then you got Department of Education, who's also not reporting adequately these pregnancies. What we are beginning to see is that we are not talking to the same numbers correctly at the same time. And there should be advocacy to say, why are we not speaking to the same number and following up? If we remember during COVID-19, we had command centers and we're speaking about one case. When we said there was a case of COVID happening at a certain place in KZN, and we're able to follow that up and say, how many deaths, how many that happened? Again, I think we need to follow suit. COVID has taught us so much on how to treat our data with accuracy and applying correct policies in place to ensure that we are advocating for the right thing. I won't even begin to speak mostly about why the numbers are just numbers for health and are not really numbers that are speaking directly to DSD and also National Prosecuting Authority. We need to get a joint command center that is going to deal with this. MEC for Health in the Eastern Cape, I was with her exactly 3 weeks ago with the best practice workshop that we had through Beyond Zero in the Eastern Cape. And she called for research. And I think that as much as there are these contradicting policies, we still need enough evidence that it need to be provided to look at each community differently, to look at a Black African child which is affected by these unintended pregnancies and why children are being violated. And we need to move beyond saying there need to be a counseling, there need to just be social services provided and looking at it from the perspective of being a social ill. But we also need to begin to look at it as a criminal offense. There are policies that are already made provision for us to be able to look at that. So we need to look at joint implementation that need to take place at this point.
So would you say we've been ignoring the very laws as the policing, as those that are meant to enforce these laws? Have we been ignoring the very laws we've put in place to try and protect children ultimately?
Probably we might need to revisit these laws carefully. Number one, it will be your Sexual Offences Act of 32 and 2007 that look at criminalizing sexual activities with minors. And that one is clear. There's no negotiation in that one. We need to begin to look at the criminal law, which look at sexual offences relating to matters, again, with strengthening the penalties that need to be given to those who are perpetrators. Yeah. But at the same time, one might need to really look at, are we tracking and are we empowering our healthcare workers to be able to report? If a school, for instance, in basic education at primary level, a 10-year-old is still at primary school, and they are recording that in a school to say, we have so many pregnancies took place in our school, are they empowered enough to follow that through and report it and ensure that there's actually prosecution?
Siyabonga, I only have 35 or so seconds, and I want to talk about something very quickly that, I don't know, it's just something that I feel, particularly when we were growing up, 80s and 90s in particular, you had so many campaigns, particularly with regards to things like HIV. You had whether it was Soul City, it was Love Life, it was all these aspects that actually helped just create such a great awareness for things like HIV that hopefully that was in part and parcel the reason why we got fewer cases as years went on. Of course, medicine changed that too, and so did ARVs, but nonetheless, there was also greater awareness. Can we not have a similar situation then for things like this?
You see, behavioral change and communication still plays a key role in all of these stakeholders, whether we put them together, but we still need to look at campaigns on how to deliver the message. It's the campaigns that need to speak to men that says this is right and this is not right, and we need to speak to the behavior of men in our community. But on the right same side, as you are saying, let's go back to what really worked. Soul City worked, Soul Bud worked, Live Life worked. But now we're beginning to look at a lot of science and innovation and thinking that putting a Black African child on a pill will be able to prevent these things. I'm not saying the pill doesn't work. I'm not saying biomedical interventions don't work, but I'm saying that behavioral change communication needs to be strengthened, and it needs to be delivered the same way it was delivered, but to the same audience and differently how.
Dr. Nzimande, unfortunately, I do have to cut us there just because we've run out of time. But I think it's an absolutely crucial conversation, and hopefully we can have it again with you. Thank you so much for your time, Dr. Siyabonga Nzimande there, who's a child rights activist, as we talk about the teenage pregnancy, but also statutory rape ultimately happening in this country and how we can curb that.